Are you using Ozempic or Mounjaro? Or thinking about it? These powerful medications are transforming weight loss and diabetes care. But beneath the hype, there's a side of the story no one is telling you. In this video, I'll walk you through everything you need to know, from the hidden risks and emerging long-term concerns to safer alternatives and how to protect yourself if you're already on these medications. We'll break down how these drugs work, what you might not be told about their long-term use, how they may affect your brain and memory, and what safer paths you can explore, whether you're already taking them or just considering it. Let's start with how Ozempic and Mounjaro actually work. These medications are part of a class called GLP-1 receptor agonists. They mimic a hormone in your body that helps regulate blood sugar and appetite. When you take them, they slow digestion, reduce your hunger, and help your pancreas release insulin more effectively. That's why people taking these drugs often see dramatic weight loss and better blood sugar control. It sounds like a miracle. But there's more beneath the surface. Now let's talk about the side effects, and not just the rare ones. One of the most common issues is nausea, which can range from mild to severe. Some people feel full all the time or even lose interest in food completely. Others experience vomiting, diarrhea, or constipation. These aren't just annoying, they can become dangerous if they lead to dehydration or malnutrition. In some cases, patients have reported severe stomach paralysis, where the digestive system almost shuts down. But the real concern is the long-term risk. These medications haven't been around long enough for us to fully understand what they do to the body over 5, 10, or 20 years. Early animal studies showed a possible increased risk of thyroid tumors, including medullary thyroid cancer. And while human evidence is limited, it's enough for the FDA to require a warning label. There are also concerns about muscle loss during rapid weight loss, which can have serious consequences for metabolism and long-term health. And let's not forget the potential for gallbladder disease or pancreatitis, both of which have been reported by users. One area that's just starting to gain attention is brain health. Some patients report brain fog, memory issues, or difficulty concentrating after starting these medications. While this isn't fully understood yet, there are theories. One idea is that the severe calorie restriction caused by these drugs could deprive the brain of essential nutrients. Another theory is that the drug may alter gut-brain signaling, which is closely linked to mood and cognition. We need more research here, but if you've noticed changes in your mental clarity or mood while on these medications, you're not alone. It gets more complicated when you factor in drug interactions. If you're on other medications, especially ones that affect digestion or the brain, Ozempic and Mounjaro may amplify or interfere with their effects. For example, combining these drugs with antidepressants, anticholinergics, or blood pressure medications could cause unexpected fatigue, dizziness, or mood swings. If you're taking multiple medications, it's crucial that your prescriber reviews the whole picture, not just your blood sugar levels. Now here's the good news, there are safer alternatives. For some people, other medications like metformin or acarbose may be appropriate. These won't cause the same dramatic weight loss, but they also come with fewer long-term unknowns. Lifestyle interventions, and I mean real, science-backed ones like structured low-glycemic diets and resistance training, can also work wonders. In fact, combining a mild medication with a targeted lifestyle plan can sometimes produce similar results without the same side effect burden. There are even newer drugs on the horizon that may offer similar benefits with fewer risks, but always weigh the pros and cons. And finally, how do you talk to your doctor about this? Don't just ask, is this safe? Instead, say, I've heard about some of the long-term concerns, what's your experience with these medications in the real world? Ask about nutrient monitoring, side effect tracking, and what the exit plan is if you want to come off the drug later. A good prescriber will help you weigh the risks and benefits, tailor the dose, and explore other tools that support your health goals. So here's the bottom line. Ozempic and Mounjaro can be helpful, even life-changing, for many people. But they are powerful drugs, and they come with real trade-offs. Don't just focus on the short-term win. Protect your long-term health by staying informed, asking the right questions, and knowing your alternatives. Subscribe to watch the next video where I'll show you how to reverse medication-related memory problems with practical, science-backed tips.